Hello, fire goddesses, and welcome to episode 97. I am really looking forward to sharing this next episode with you. I have a very special guest, Dr. Ratti Handa, who is an airway focused dentist. And she's actually my dentist who has been helping me in my airway journey since early this year in 2022. And I wanted to bring Dr. Honda on the podcast because you may or may not know this. If you follow me on Instagram and you have seen my stories, you know that I'm really passionate about my personal airway journey and in getting the word out and advocating and informing about the airway, because a lot of people just brush it off and think of it as either no big deal, or they just think that they have these ailments that they just have to live with, such as TMJ and migraines, among many other things. And what they don't realize is that if they improve their airway situation, they would be feeling so much better and could be potentially be avoiding a lot of diseases. I'm going to link all of her information and all the books that she mentioned in the show notes. So if you're listening and don't have a chance to write anything down, just refer to the show notes. All the information will be there. And without further ado, I want to welcome you all to listening to Dr. Ratti Handa. Hello, fire goddesses. Welcome to the Reclaim Your Fire podcast. My name is Angela Noel, and I am a prosperity coach for the newly awakened or awake curious, driven overachiever, and overdoer. After running a successful acupuncture practice in Boston for 12 years, I decided to hang my hat by closing the practice and pursue what it is that I'm really meant to do in this world, and that is to serve humanity online on a global scale. Using my background in Chinese medicine, along with the brain science of habits, spirituality, and divine masculine and feminine energy balance, I am here to help you not just understand, but know how powerful you are, and that you are the person who is responsible for having the finances, inner peace, radiant health, and energy, aka the fire, in your life that you've always desired. My intention with this podcast is to serve humanity, no matter what gender you identify as, to help bring out the divine feminine goddess in each and every one of you. As you probably are already aware, the world is changing and is begging for the goddess to come out in each and every one of you. So, fire goddesses, stay tuned. Hello, fire goddesses, and welcome to the Reclaim Your Fire podcast. My name is Angela Noel, and I am the host of this podcast. And today I have a very special guest that I can't wait to introduce to you. As you will quickly discover, I've had a personal journey in working with Dr. Handa, and today I have her as a guest. So I'd like to introduce you all to Dr. Ratti Handa. Hi, Ratti, how are you?
I'm great, Angela. Wow. I think sometimes when I still hear myself addressed as a doctor, it takes me back to my white coat days of college, when it was just this one big mystery to be a doctor.
Yeah.
And just recently, my father he texted me a picture of my diploma or something, and it had the doctor's oath on it, and he said, "Do you still remember it?" And I said, "Yes, I do, every day, actually." So it's kind of cool.
Oh, wow. So that's actually interesting that that's the first thing that you mentioned, was the going back to the white coat of being in school, because I would love to personally know more and share with the audience about your journey, because what you're doing right now as a doctor, as a dentist, is kind of different, right, than how you started?
Very different. I think the word and the image of a white coat, have traditionally evoked a sense of like, wow, I really did this, and it's pretty awesome and cool, to wow, I'm so limited in what I'm supposed to do and what the world expects from a doctor in a white coat or a dentist in a white coat. So I think it evokes all these different kinds of identification images and thoughts. And so as my journey started, because my dad's a dentist, and quite frankly, he said that he kind of steered me in the direction to be a dentist over being a vet. I did my initial dental degree in India, and then I came to the US and studied at Tufts Dental School. And both places, I had a very similar experience in college. Lots of hard work. I got great grades, but I just didn't feel, I felt something was missing. And it was across the seas, literally. So it wasn't just an Indian experience or a US experience. And I think when I started working, I started realizing how fascinating it was to connect with patients, listen to their stories. And quite often they wanted to come back to see me for dental work, but my stories and their life was a big part of our visits. And I learned that there was no insurance code for that, that most places did not want a young dentist like me spending that much time with patients. It was all about, revenue, and I think that led me down to really seeking. I think I was a seeker always. I started my journey with the Pankey Institute down in Miami, where I learned from the teachings of LD Pankey, who's no more with us, about really how to see that person behind the teeth. And even though there was a lot of clinical training there as well, for me, what really stood out was, oh, I had permission to see that person behind the teeth. And from seeing that person behind the teeth, I had permission to start to know myself more, and then know my patient more, and then, of course, know dentistry more. And I think that's where it all started to evolve. And through the years and ups and downs of, both like having children and getting divorced and economic crashes and even a pandemic, I think what shifted for me was always seeking, well, how is this whole body healing? How is this really healing the spirit? How is this healing emotions? How is it, why does it manifest physically? And learning to look at my own chronic pain symptoms over the years and understanding that they were here to teach me about something. And that's what led me to my dental airway journey. I think it was 2016 or 2017. I was just looking for a fresh start. I had just been divorced, life completely changed, and I attended an airway course by Dr. Rouse at the Spear Education in Phoenix, and it just shifted everything for me to really start to look at dentistry through the eyes of an airway. And one of Dr. Rouse's favorite lines were, "Who is your Jake?" So Jake's his son, and his son Jake is his force behind him discovering more of airway-centered dentistry. And I came back, took one look at both of my own kids, and I said, I have my Jakes right here. As a parent, you do everything to try and protect your kids, nurture them, take care of them. And right here, I had my Jakes with impaired airways that was being affected by their oral structures, and I could do something about it. So I think that's what inspired me to go down the airway journey.
So, in case you haven't realized at this point, Dr. Handa Ratti is an airway-centered dentist and the owner of It's Beyond Dentistry, right? Is that the name of your practice?
Yes.
So,
the name of practice is also funny because it's really my name, and I think we've called it Beyond Dentistry for a while.
Yeah.
For me, that's almost like a limitless word because I don't know what's beyond dentistry.
Well, when I was listening to your journey, I mean, when I think about going to your practice, Rati, like I think about going to see you. I don't necessarily think, oh, I'm going to go to Beyond Dentistry today. But when I was
Mm.
listening to your journey, I was thinking, oh, what a perfect name for a practice, because that's exactly like what led you to do what you're doing. It's beyond dentistry. It's looking at the patient behind the teeth from the standpoint of their mind, body, and spirit. And I would love to just dig into that. Well, first of all, I would love actually, because I know this is kind of a hot subject right now. I talk about it, as you know, on my Instagram stories when I come to see you, when I'm doing my myotherapy, when I'm getting my new appliances. And I have people reach out to me saying, so why exactly are you doing that? And I would love if you could just share, why the airway? Because I can share from my perspective as a patient, but what is it about the airway specifically that why should we be paying attention, and how does it affect beyond our health and beyond our dentistry, and how does it affect our mind, body, and spirit?
So I think that's a super great question. And even though I am going beyond dentistry, I still practice within the confines of my license of being a dentist. So I'll start just from ground zero. The airway there's a branch of medicine, not sleep medicine. And now in dentistry, we can call ourselves sleep dentists if we have the accreditations. And I am a sleep dentist. In fact, the American Dental Association has made it mandatory for every dentist to screen their patients for sleep disordered breathing. It's mandatory, it's required. Depending on what we find, we can't actually say that you have, sleep apnea or whatever, because that is a medical diagnosis. So part of this is we do partner with all kinds of specialists. But what we have learned is that the size and volume of your airway in most patients, not all patients, most patients, is determined by the size of your upper and lower jaws, by adequate nasal breathing, by lips being closed, by your tongue being in the optimal resting position, and enough tongue space. A lot of that guides the size and volume of the airway, which then also guides how you sleep. Because if you don't have enough tongue space or an optimally functioning tongue, or tight fascia, or an improper bite, you're going to have a host of issues, from TMJ issues to teeth issues like cracked teeth, loose teeth, eroded teeth, tongue ailments like a swollen tongue, numb tongue, or sometimes it affects your taste buds, all the way to that you don't have restful sleep. And I'll talk a little bit more about that anatomically. So when we don't have enough tongue space or tongue function, in phases of our sleep where we are deeply resting, we don't actually have a lot of control over what our tongue does. So our tongue can't, if it doesn't have the room, nor has it probably been trained or optimally functions, can fall back on that airway. And when it falls back on that airway, depending on where you are in your sleep journey or sleep diagnosis, you can have something called upper airway, UARS, upper airway respiratory syndrome, or all the way to sleep apnea. Again, those actual diagnoses get made by the sleep doctor. But on one end, you can have a more collapsed airway. So where your airway is getting choked, like a collapsed straw, if you will. If you're trying to suck through an inefficient straw, your body has to work harder. So that's when your heart rate's up and your body's just working. You're in a state of arousal. When you those states of arousals is when you'll tend to grind and clench more, move around more, wake up more. You're more light sensitive, sound sensitive. Like you need that perfect sheet, perfect pillow, the light has to be just perfect. Those are all, some UARS patients have to exercise every single day, otherwise they can't fall asleep. Then you have all the way to sleep apnea, where the patient might stop breathing for more than 10 seconds or more per hour. Those are measured by a number called AHI on the sleep test. And when that happens over a period of time, this patient's body's gonna kind of give up too. Like sometimes when you stop breathing for more than 10 seconds, you're going to do this big, why don't we do it now? It's it's a cool experiment. I'm gonna set a timer, and it's really uncomfortable, but I think it might be good to do. Is that okay?
Yeah, let's do it. And I think it will really help the people listening, because I know there's a lot of people that snore and just think it's, oh, I'm a snorer, or oh, my husband snores, but they don't look at it past.
And I want to come back to snoring too. So by the way, obviously, if you really can't do it, don't do it. This is not meant to cause you any sort of significant distress. Do it up to the point that you feel slightly uncomfortable and stop doing it. So I'm going to set the timer, and you're just basically going to hold your breath for 10 seconds. Ready, set, go. So that was 11:21. So now for some people, that's going to be no problem. For some people, it's going to be really hard. So for me, I noticed that I was starting to have a little bit of fluttering in my stomach and diaphragm. Like I was ready to take a big breath. How was that for you, Angela?
Yeah, I noticed that I definitely had to use like I had to redirect my mind, because there is that tendency to want to go into fight or flight. And I was like, no, everything. And I kept saying, everything's fine. It's just 10 seconds. Yeah.
Yeah. And there will be varied experiences between yours and mine with the audience. So at night, we can't do that. Our brain's supposed to be shut off. So either it turns on like yours did, and that means we're robbed of sleep because our mind shouldn't be thinking, or it stops even as it gets trained to this state. It even stops helping you. So you may have those gaspers who are sleeping next to you, like they'll stop breathing, like you'll physically see their chest not moving, and then they'll do this big sigh, and for some patients, they may not even react to that as time goes on. Some people snore. So snoring is the soft palate in the back of the throat vibrating. Again, vibrating with lack of tongue space, inflamed soft tissue in the back, enlarged tonsils, adenoids. A lot of things play a role in airway health. Definitely don't want to undermine tonsils and adenoids in airway health. And so when that air makes that noise, is actually the blood flow up the blood vessels in our neck that go to our brain, where there's vibrations of that blood flow in the carotid arteries. And that is, evidence shows it's linked to strokes, the vibration of that blood flow in those arteries. So smoking is not funny. Smoking is not a sign of deep sleep or relaxation. Snoring is not annoying. It's way beyond that. It's a distress signal, a pre factor to possible heart attack, strokes, diabetes, high blood pressure, all kinds of issues, Alzheimer's, dementia. So snoring, even in the movies or cartoons or anywhere, it's depicted as something funny or silly or cute, and it's not.
No, it's a serious health issue.
My sister, who was visiting me from India recently, she was on a train back to New York City. She's selling a daughter in New York City, back and forth from Boston, New York, Boston. And she said, one of her trips recently, I said, how was your train ride? And she said, I slept really well. I had my mouth open the whole time. And I thought to myself, shame on you, Ratti. You really didn't teach her anything the whole time she was here. And so that was not fitful sleep. That was a sign of distress, you know?
The mouth
And
open.
yeah, and
Yeah.
you know, um, we happened to share a bed for a few nights that she stayed with me, and I said to her, "You're snoring." And she said, "No, I'm not snoring." And it reminded me of the fact that there's these dynamics between a snorer and a snoree. The snorer has no idea except that he or she is exhausted in the mornings and the whole world is annoying. And any chance they get, they'll just want to sit and sleep.
Yep.
And the snoree hasn't had a single wink of sleep because their sleep's been disturbed and now they're irritated with the snorer. So there's this whole, and the snorer doesn't even believe that they snore.
No, they don't know.
It becomes like a blame game, you know? And it's not a blame game. It's deeper than that for both, actually.
Yeah, and I feel like a lot of people listening, I know I've been there, I've witnessed my, family members snoring, partners who snore, being disturbed by. I've been told that I snore, and that in addition to some other things that I was starting to notice, I don't like to really put in the age factor. So we'll just say in recent years, not that I'm ashamed of my age or anything, but I was starting to notice like biological changes in my jaw and structure and even just TMJ. I mean, I feel like there's so many things we could talk about, Ratti, but what I realized, especially since I started working with you, and then I had a previous dentist recommend that I start mouth taping because I was like, what is it? Bruxism?
Mm-hmm.
Is that the right word? When you push your tongue against your teeth to swallow? Is that correct?
Bruxism is actually just another name for teeth grinding or clenching.
Okay.
And the tongue thrust is maybe what you're talking about.
Tongue thrusting, yeah. And I feel that was so eye-opening just to learn about that. And then I went to like this other webinar with another dentist in my community who lives in Australia, and she was talking about even how it can affect the sexual organs. I mean, I feel like we could go so many different places. So I'm going to have you pick, like, in addition to the dangers of this being, snoring being a disease, like I've heard people use even the term snoring to death. So we know that now. What are some other things that can be affected just by mouth breathing, even if we're not sleeping, just during the day, like subconsciously, we just have our mouth open? How can that affect our lives?
So I think I'll go back to you saying, that you don't want to say it's age related. But the thing is, some of these things are age related, especially in women, because our hormones change.
Mm-hmm.
And we do move from more clenching and grinding issues because we have more, we have different estrogen levels to when we go into perimenopause and menopause, we have different hormone levels. So as those hormones change, the symptomatic outcome of an airway disorder changes. It goes more from bruxing, chronic headaches, kind of stuff like that, all the way to sleep apnea. So then the risks are more of those other illnesses that I talked about, heart attacks, strokes, Alzheimer's, dementia. So it goes from so the symptoms go from fatigue, exhaustion, anxiety, restlessness, ADD-like behaviors, weight fluctuations, gut fluctuations, teeth issues like we talked about, cracked teeth. And then it can change to like some of those other medical most serious illnesses. So, and in between these two, there's a host more. Reflux, for example, is linked to, people who take even just an over-the-counter Claritin every day. So I had a patient recently, she even forgot to tell me she takes Claritin every day because it's her normal. And so anybody who's got sort of like this post-nasal stuffy or, just anybody who basically mouth breathes. So mouth breathing, again, you don't, and again, so whenever I used to ask people if they mouth breathe, they used to say no. So if you're in the audience and you're listening to it, and if you got asked if you mouth breathe, maybe you might say, of course not. Because again, the connotation of a mouth breather is somebody with their mouth wide open, slobbering, like kind of like breathing like this. And that's like the most obvious mouth breather you can spot from 2 miles away. We're not only talking about that mouth breather. Mouth breathing can be very subtle. I know I perfected it over the years. Mine has been super subtle. It almost looks elegant because my lips are elegant mouth breather.
Elegant mouth breather.
Yeah. So your lips are barely apart and you are breathing both through your nose and your mouth. But that's called mouth breathing. So the right question to ask people is, do you ever have your lips apart when you're not talking? So when you're talking, your lips have to be apart. But when you're not talking, are your lips ever apart? Talking, swallowing, all those are active movements. Of course, your lips are going to be apart. Our lips need to be together all the time. I mean, the goal is really even an exercise, which is really hard, but that's the ultimate goal. That gives your body more nitric oxide and builds your cardio strength and stuff. So if you just practice for a minute, just close your eyes, and I breathe in. So I'm going to have you breathe in to the count of 4 and breathe out to the count of 6. So like a longer exhale. So breathe in, 2, 3, 4, out, 2, 3, 4, 5, 6. Now I want you to swallow. Just follow your swallow. Don't think about it. And notice where your tongue is. Is it resting on the bottom? Is it resting up top? What are your lips doing? Are you breathing through your nose? Is your stomach rising and falling? Does it feel like a full, easy, circular breath in and out? For those of you who have a way of looking at your heart rate on your watch or an Oura ring or whatever, what's your heart rate as you're practicing this? How do you feel? Imagine, that image of Buddha. We all have Buddha like just meditating. You want to be in that Zen place of lips together, relaxed position where the tongue is up on the roof of the mouth, just the slightest space between your teeth not touching, and nasal breathing. In this position, you have optimal TMJ position, nasal breath, lip position, and tongue position. And this is what resets your vagus nerve, which then, as you know, balances sympathetic and parasympathetic. So
that was so relaxing. I feel like you could be a guided meditation.
It's on the books. I want to do that for my patients.
Yeah,
Personalize it to everybody, like Um, but at the end of the day, through airway center dentistry or just dentistry, we are mouth doc, like we look in the mouth all the time. And my invitation to any possible patient, dentist, hygienist, whoever's listening to this, next time when you look at someone's tongue, don't just think it's in the way. Because in the past, I used to think, use my mouth mirror to remove the tongue out of the way to look at the tooth or the gum, which is also important. We have to do that as a part of health. But the next time you just go to pull it out of the way, look at what you're pulling out of the way. Just be curious about it. Because it's a very, very powerful muscle. In fact, it's not just one muscle, it's many muscles and many cranial nerves. And it is a part of the deep frontline fascia in our body that connects the fascia all the way down to your toe.
Yeah. Yeah, and everything's connected. I mean, I even think about just, dentistry as an example. Like so much of our like, I think it's changing and becoming more holistic, but the idea of your teeth being separate or your gums being, like separate from the rest of the body. And there's so much that can be indicated. And there's so many signs that can come from the mouth and from the jaw. I mean, I just think about my clients, and I've had numerous clients over the years with TMJ and who have struggled and suffered with migraines. And looking back, and I'm thinking, I wish I knew more about the airway stuff, because so much of that can be alleviated by just, even just that exercise, just having the awareness is huge. So, for people that are listening, Ratti, and they're suspecting that, hey, I might need to look at this further, what would you suggest for them? Would you suggest, are there any resources that you enjoy or that you refer to your patients? Exercises, or maybe they just need to come and see you or an airway centered dentist? What thoughts do you have for people that are listening and they're thinking, this is really resonating for me?
So I think for me, it starts with awareness. Awareness is the first step towards getting resolution. And, going back to just something you said about you have many patients with TMJ, it's no wonder you have many patients with TMJ because of the kind of work you do. Because on an energetic level, spiritual level, the TMJ holds a lot of unresolved issues. Even just incorporating Louise Hay's book, the self-healing book, I forget what she has, but it makes sense. So there's a lot of unresolved emotions and anger, rage, not anger, because I think anger is healthy, held in our TMJ joints. So my tribe or my patients usually involves somebody like me, depending on what they need, my functional therapist, a great osteopath, massage therapist, but also a great coach like yourself, because you need all the layers. And a great resource would be there's a great book written by James Nestor called Breath. Great. And he's a journalist. He's nothing to do with the dental world, but he dove deep into the airway. And it's a great read. So that's a great place to go. The Breathe Institute in Los Angeles, Dr. Zaghi, has changed the world in how important. He's an ENT. I've trained personally with him, hands-on, but he just is so committed to research and growth. And so I think they have a lot of educational information that patients can go listen to There's another great book called Sleep Interrupted by Dr. Stephen Pack. There's Gasp. I forget the author. There's Life is Airway by Dr. Meghna Dasani. There are tons of resources out there. There are Facebook groups now, but awareness, learn, and you can always reach out to us for referrals to practitioners in other states or parts of the world. The Breathe Institute has great referrals too, or come see us. And
your office is in Acton, Massachusetts, so it's in the Boston metropolitan area. So I will link up all of your information, your Instagram, which is it Dr. Ratti Handa, your handle?
I think it's Ratti Handa DMD.
Okay, Ratti Handa DMD, which I'll put in the show notes, as well as your website and all your information. Ratti, thank you so much. We talked a little off the air before we hit record, and we talked about maybe going into the spiritual aspect, which I would have loved, but I feel that this information is going to be so useful and insightful for the goddesses who are listening. And I'm so grateful for your time today, and also just for helping me and supporting me on my airway journey. My life is seriously, I don't know, 8 months in, maybe 9 months, just under a year in, and I've noticed such a big difference in how I feel, how I'm breathing, and I've only just begun. So thank you so much. I really appreciate you.
Thank you. We appreciate you. Thank you so much.
Thank you. Until next time, goddesses, be radiant, be powerfully authentic, and know that you can reclaim your fire at any time. Take care. Hi, this is Angela Noel, and thank you so much for listening to this podcast. If you have found value in listening to this podcast, I would be so grateful if you could kindly share this podcast with those you care about. Please help me spread the word of empowerment and possibility and expansion by sharing this podcast. Or you could also leave a review on Apple Podcasts. Remember to follow me on Instagram at I am Angela Noel, or you could go to my website at www.angelanoelinternational.com to learn more about my work and to find out how you can work with me. Thank you very much.